Scientists have been expecting the virus that causes COVID-19 to mutate, and there is now new research that suggests one of the dominant strains, the strains found here in Canada, is in fact mutating and is in fact now more infectious. Christine Birak looks at the implications of that as she reports from Toronto today.
Keep asking our experts, especially the molecular biologists and the lab tech people.
Early research suggests the virus that causes COVID-19 may have become more contagious. Dr. David Williams is Ontario's Chief Medical Officer of Health.
There are mutations taking place, but is it having significant effect on the virus? The so-called attenuation of the virus. Haven't seen definitive evidence of that yet.
This latest study isn't peer-reviewed yet, but others are reporting similar findings. American researchers say they found a mutation known as D614G. It's now the dominant strain of coronavirus circulating in Canada, the U.S., Europe, and Latin America.
That viruses do this all the time. They will have random mutations that get generated into their genome. Sometimes they have consequences. A lot of times, and more often than not, they have no consequences.
Jason Kinderchuk studies emerging viruses at the University of Manitoba. He says researchers did find that animals infected with this particular strain could carry higher levels of the virus in their respiratory tract.
So does that mean that they're better able to transmit? We don't know. We're still trying to figure that question out.
Kinderchuk adds studies are not showing that the virus has become any deadlier. And while the virus itself may be undergoing small changes, public health advice to protect yourself and others remains the same. Christine Birak, CBC News, Toronto.